Turning to news, today the ban on abortions in Iowa after fetal heartbeat activity is detected goes into effect. Our Griffin Wright joins us live this morning with what the law means for Iowans and healthcare providers. Good morning, Griffin.
Good morning, Kaylin. For healthcare providers that assist in or perform abortions like Planned Parenthood, Iowa's fetal heartbeat law going into effect today means some big changes. Now, Planned Parenthood will still plan on providing abortion services to patients. It will be in compliance with the law and only done if there is no cardiac activity detected in the embryo. If they are unable to provide an abortion here, they will have patient navigators that will assist patients in setting up appointments in neighboring states with less strict laws. In preparation for the law to take effect, Planned Parenthood scheduled as many patients as they could last week.
So we were overbooking schedules, but I would say 30% of the people I talked to on the phone told me that, well, I can't get off work this week. I'm already scheduled for work this week and I can't find daycare. I can't get off work. I have it for next week. So unfortunately, those people, I was able to connect them with a navigator and they will have to go out of state.
Provided patients can travel to them, there are many neighboring states with laxer laws around abortion. Abortion access is available in Minnesota with no limits. In Illinois, it is available until fetus viability. In Wisconsin and Kansas, abortions are legal up to 21 weeks of pregnancy. Nebraska bans abortions after 12 weeks and has a 24-hour waiting period. Abortions are banned in Missouri and South Dakota with limited exceptions. Planned Parenthood plans to expand or to add capacity to their clinics that are in neighboring states and cities like Omaha, Mankato, and Minneapolis.
Okay, Griffin Wright reporting live for us this morning. Thank you for that.